Hello everyone, I am Dr. Aruna Kumari, consultant obstetrician and gynecologist, practicing at Cloud9 Bellandur and Sarjapur in Bangalore units. Today let's know about what is dating ultrasound. What is its importance? Dating ultrasound is the ultrasound which is done between 7 to 11 weeks. Why it is important? Because this is the time the crown rump length CRL of the baby can be best measured. Okay, so it is the measurement of the baby from the top of the head to the rump buttocks area. Okay, why this is so important for the dating ultrasound, for the delivery calculation, delivery date calculation? It is most reliable. Only the error of only 3 days it is there. So it gives a clinical decision making when the baby is growth restricted, it is late onset, early onset, when preterm delivery is there, patient doesn't remember her last period dates. So many of the patients sometimes, doctor, I got before Diwali, or after Diwali I got, but I don't remember the exact date when it started. Sometimes they forget, sometimes they think that they got in between little bleeding they might have got. So that also they think to be period. So in such scenario, the dating ultrasound gives a best diagnosis for the calculation of delivery date, which helps in the clinical management and decision making when to deliver the patient in high risk pregnancies. Okay, so CRL measurement at 7 to 11 weeks is the best thing for the diagnosis of the delivery date. Okay, and apart from that, late onset of growth restriction, or at 7 months when we do the ultrasound, we will see that the baby growth is lagging. So we can recalculate the dates. Okay, based on the 7 weeks what the ultrasound was done, based on that we recalculate the dates for the delivery. So it is very important, and always keep the records safely, your ultrasound reports, everything, the complete file you should take it to the doctor whenever you are traveling. Sometimes some patients, they do the ultrasound in different city, while traveling they would have lost the reports. So at least keep the photo of the reports so that you don't lose the important information which is required for the clinical management. And ultrasound doing from a good expert radiology is also important, because the measurements what it is taken, the accuracy is almost 99% to 99.5%. So for that reason, good early pregnancy scan, the dating scan will help in the clinical management, and when to deliver the patients, it is very important. And one more thing is, whenever you have irregular periods, you tell the history to the doctor properly. So this was your irregular periods, when you got the dates, like previous pregnancy I had a miscarriage, that time I don't know, the periods were very irregular. So this time also I don't know, I don't remember when the patient tells, we do the dating scan and follow it up. Dating ultrasound is another important reason is the patients when to deliver when it is there. Sometimes they would have come with the leaking, water breakdown, those kind of problems. But these, when we are calculating the gestational age based on the dating scan, it gives the NICU doctors, also the neonatologist, to assess how long the baby has to be in the NICU care. Should we give the steroid injection for the premature birth when the patient is at preterm birth risk? So whether we should give the steroid injection for the fetal lung maturity. For these decision making, it helps. So it is very important to do the dating scan and preserve those reports for the follow-up and better management of the antenatal pregnancies. So the high risk pregnancies, it matters a lot.